We created the program so that we could identify and recognize those associates who have gone well above and beyond, whether it was technically or in a management leadership style, so that they can help move UC Health from being good to being great. The initial process came from those who nominated the recipients. They sought through and looked for and decided that these were members of their department or from the team that they participate in who were worthy of receiving such a prestigious award. Once they made their selection based on the criteria that they had, they forwarded it to the senior executive team. And we sat down and we took a look at the nominees and we took a look at a holistic process. Okay, the department, the location, and then the enterprise, to make sure that we selected the one that represented the best of all three. The associate or leader must have demonstrated ingenuity and initiative by identifying an opportunity for improvement within a division, a department, a program, a service line, or a care path at a UC Health facility. The associate or leader must have created an idea for improvement or enhancement and participated in developing a plan which sufficiently addresses opportunities for improvement in care, in service, or efficiency and effectiveness. And the associate or leader must have demonstrated exceptionally effective levels of care, service, teamwork and collaboration, and or cost efficiency on behalf of the organization. These are the best of the best.
My job title is Vascular Access Coordinator, so that means that I am the kind of liaison between our nephrology departments and our transplant surgery department. Prior to me starting this job didn't exist. So a lot of patients that were either on dialysis or getting ready to start dialysis would fall through the cracks because there was no one there to kind of lead them through the process of, all the appointments and surgeries that they need.
She is a single person department and she works mainly with physicians, whether are surgeons or nephrologists.
I think the most enjoyable part about my job is the fact that I get to educate these patients on what they're going through and what's going on with their health and their lifestyle. Changing 30 years of habits is a little difficult to do in 1 or 2 sessions with me, but it's very rewarding to kind of get to know these patients and help their education level and get them through this process, because we're not only intervening on their health, but we're changing their lives forever to start them on dialysis. So helping them understand that and make that the best possible experience.
I think she created something from nothing. I mean, she came in with a lot of enthusiasm, a lot of hard work, and made a difference. And I think for that, she deserves that award.
It's always an uphill battle to try to make a difference in this patient population's lives. So I work really hard every day to just come in and make a difference for these patients and help improve their life. So that's, my contribution as much as I can.
I'm a respiratory therapist. I'm the sales manager for the clinical assessment team here at Drake. I sell the human resource here at Drake, and then they sell Drake.
When Bob took the position as an assessment liaison, he was given the assignment to market the Dayton area. And as soon as he took over, he grew that market, I'd say about 200 to 300% within just the last 3 years.
We're a referral-based business, and so the hospitals in the community are our customer. And to have the UC brand behind me makes that job that much more easier.
Teamwork is important for Bob. He feels that when you work together as one, you'll definitely get the job done.
We can change a life, and it's because of the people we have in place already. So it's easy to sell when you're surrounded by good people.
He is patient-focused. He spends a lot of time talking to his patients and their families, answering their questions, and making sure that they're comfortable when they come to Drake. He's knowledgeable, confident, team player, and most of all, he advocates for his patients.
Being a people-first person, we bring those patients in, and it's the little things that go a long way. When you're sick, you need that extra touch. You need to know you're not just a number or a bed. It's how you go about that, and that's why myself and the rest of the team, we follow up with the patients. We didn't just bring you in here. We're here to listen. We're here to hear you.
My job here in the emergency department is I'm the day shift charge nurse. So it's more of like a traffic control type job, you know. We make sure the flow of the department is going well, not only with the patients, physicians, also, you know, our other teammates.
Elizabeth has just been one of our star performers in emergency department. 2014 has been an amazing year for Elizabeth. She has been our charge nurse for the entire year. During this time, she started off the unit-based council.
Well, since opening the doors here in 2009, we've always had a model of immediate bedding. And it's an excellent model. It's the best practice for the patients. And I work my hardest to make sure that the patients are safe and taken care of and brought back to beds immediately. And that just brings such great satisfaction to the patients to not only be seen by a nurse and a doctor immediately, but then they feel safe.
She actually worked collaboratively with the ICU unit-based council chair to create a pathway and a process that our two teams could work collaboratively to have that safe passage from the ED to the ICU.
We also initiated the ICU bedside reporting, which is also a great safe practice for our patients to not only just call to give, report nurse to nurse. We now take our patient from the emergency department to the ICU and give a face-to-face nurse-to-nurse report. And we've received great feedback from that, from both units and from our patients.
I love working with Elizabeth. I know when she's in charge, that unit is safe. I mean, she is just a dynamic, dedicated, passionate nurse, and she is well deserving of this award.
We can't be successful as a system if we only recognize only part of that. While our associates are down in the grassroots, making sure that things that we need to happen and that they happen successfully for patients and families, we also have to have those leaders who give them the resources to make those things happen.
I think as my job on a day-to-day basis, it's changed dramatically over the past several years. It started as being very pharmacy specific for Westchester, then with some pharmacy expansion to Lindner Center of Hope recently, and also kind of a different path of being an administrator and assistant to help UCP with the hospital-based clinics here.
One of the things that he likes to do is make sure that we have the best pharmacy services and is willing to help support the other facilities so that we have 24/7 pharmacist support for those locations that aren't 24/7. So over the last few years with bringing Drake as well as Lindner Center of Hope into the UC Health family, Westchester's been able to support them, and in order to do that we needed Kevin's leadership to put that in place.
I try to keep usually with 4 focus items. One is concentrate on staff satisfaction, try to make sure things are running operationally efficient, focus on some financial responsibility. Lastly, make sure we have positive patient outcomes. I think my leadership style is supportive for my staff. I empower them to make decisions. I always like to look at the greater good and what we can do as a team and our team successes versus more than me as an individual.
He's always looking for new and better ways to do things. And I think that really demonstrates his leadership in that he's creative and not afraid of change.
Because I try to provide value to the organization, value to the patients being served, and value to my staff. I think if you start the day each morning thinking about how you can add value, make the place better by the end of the day, you'll do a good job.
I think everyone, myself and those that work with him, really appreciate his passion for his position, his desire to help others to succeed. And so I'm really excited to see him as being a finalist in this award.
I provide clinical leadership for transplant services and solid organ transplant, which is our kidney, pancreas, liver transplant programs. Another area that I work in, of course, is the dialysis unit. And then I also cover infusion services.
Jason has an enthusiasm that is contagious. People very much enjoy working with him and for him.
A leader is really only as good as those that work under them. I think everybody comes to the table with a strength. It's our job as leaders to really identify what those strengths are and maximize them to the full capacity.
The nurses themselves have expressed great satisfaction with the increase in their education.
Professional development is another thing that I really strongly advocate for. I think it's a pillar to success in our organization because it only makes our areas stronger.
He can see the bigger picture and kind of break it down into the smaller, manageable parts.
You can't climb a mountain in one day, so we would just break it down, the process improvement down, and take baby steps to get to the final end product. Status quo is never good enough for me. It's like saying I want to be second best, and I want myself, our teams, our system to be the best.
Jason is just the ideal leader to show us how we can contribute to our organization and how we can develop more pride and share in the successes.
At the end of the day, it's about providing the best outcomes for our patients, and if we are providing patient-centered, life-changing care, we've been successful.
When I see how Jason does it, that's how I want to do it. So he is a person that people want to emulate.
So we felt that we would like to nominate Leanne for the Associate of the Year Award because of the tremendous efforts that she's done propelling the Physician Liaison Program to help support Westchester Hospital.
Our program is responsible for being a contributing team member to Westchester Hospital growth. We identify growth opportunities by understanding the physician and clinician needs and responding to them so that we can find a win-win-win. You know, the win for UC Health Westchester Hospital, the win for the customer, and most importantly, the win for the patient.
Leanne absolutely upholds a can-do attitude no matter what. Regardless of the task that is given to her, no matter how high the goal is, how far away it is, Leanne jumps in with 110% effort and absolutely will not give up.
The word can't is not in my vocabulary. And what I mean by that is that we're in a competitive market. So to have the stamina, the endurance, the determination to turn things around, you know, we just are very persistent. There are many different things that I enjoy about working at UC Health. First and foremost, we are a large entity. We don't cherry pick. We serve all. Secondly, the people that I have the opportunity to work with are truly inspirational. You know, and they've helped me grow.
Truly, if you look at the actions and her contributions, it really does uphold what this award is about.
Sure, it feels really good. I think employees want to feel valued and respected, and you know, so that feels great. Of course, these projects have not been able to be accomplished without the work of everybody else, and I'm greatly appreciative of that.
The winners here represent UC Health in that, you know, we wish that everybody could be a winner, but there's only one award for each category that we can give. But our belief is that, you know, as we take a look at where we've come from and where we want to go, that the most important part of that journey are the people that are coming along and making sure that everybody else that's a part of the journey is successful.